Thanks for that introduction, Nuala. So my name's Emily Kennedy, and I am a pharmacist, and I'm based in Scotland, in Dumfries in Scotland. For those of you that know Scotland, it's just around the corner from England, basically. Get across the border and turn left. And I am English, but I've been in Scotland for a long time, and been working in primary care in GP practice primarily for the last 20 years. But recently, over the last couple of years, been seconded to Scottish Government to work on the development and implementation of various strategies that help contribute to the net zero targets for Scotland, and in particular for the respiratory, polypharmacy, respiratory prescribing guidance. So I want to share a little bit tonight about sort of really what we're doing in Scotland across all the sectors, but sort of really kind of reflecting a lot on what the work that I'm doing within Scottish Government and the Effective Prescribing and Therapeutics Division. I've also got sort of fingers in lots of other pies. I do a lot of work with NES, which is the NHS Education for Scotland. So it's the CPP equivalent, for example. And sort of within that, sort of do a lot of cross-sector education. So we've got something called practice-based small group learning, so PBSGL. And I don't know if any of you have heard of that, but I'm an author and an editor for those modules, and interestingly, we've got a climate emergency module and respiratory module, polypharmacy modules, all of these that help feed into that climate emergency and sustainability strategy. So let's hopefully see if I can move my slides on. Okay. So the first, I think I've skipped a slide. Sorry, go back. So, what to set the scene? We had our climate emergency and sustainability strategy published in August 2022. And the aim of that is for NHS Scotland to achieve net zero carbon emissions by 2040. And this covers a whole range of aspects. For example, buildings, travel, none of which will surprise you. The use of green spaces, but the section that I'm sort of most involved with and most concerned with is the sustainable care section, and that includes applying the values of realistic medicine, green theatres, and the respiratory and polypharmacy prescribing guidance in particular. And the aim of this is to reduce. Well, one of the aims, for example, the aim is that collective contribution to net zero, but there are specific targets, one of which is the aim to reduce our emissions from inhaler propellants by 70% by 2028. So I'll talk more about that later. And realistic medicine is sort of a term that's used quite a lot in Scotland. I think every kind of home nation has their equivalent, but realistic medicine is definitely the vocabulary that we use in Scotland. And the thrust of this is to reduce waste and harm from medicines. And this is our Chief Medical Officer, Professor Sir Gregor Smith, publishes an annual report, and this was last year's annual report. And it really does acknowledge the challenges of a multitude of things, including health inequalities, the increasing demand for health and social care services, but in particular, it's got a really good section on the effect of climate emergency on our health. So there's a really big focus right from the top, from our Chief Medical Officer, to really think about climate and health and that relationship to the planet and people, and how that affects health, which I'm sure we're all very well versed in, but it's getting that message across to not only our clinicians, but our population. And the other terminology that's starting to be used more and more in Scotland is value-based health and care. So this kind of is going hand in hand with realistic medicine. It's really helping us get the most out of our services and care. And it's not just talking about prescribing, it's talking about holistic health and utilising our practitioners more effectively. But there's obviously a big focus on using medicines sustainably. And that's not just from, I think sustainability can mean a lot of things to a lot of people. And for our audience, it means about protecting the planet. But in NHS circles, it can often mean thinking about costs, but it's also thinking about helping our practitioners be sustainable as well and not burn out. So there's lots involved with the sort of whole realistic medicine agenda and value-based health and care. So one of the aspects that was mentioned in the realistic medicine report and in the climate emergency and sustainability strategy in Scotland is the National Green Theatres programme. And this is a programme that's really been developed from the bottom up. So it's practitioners, largely anaesthetics, and a key pharmacist who you'll know, Alifia Chakira, if you've been involved with this network, has been a real proponent of this in terms of anaesthetic gases and encouraging sustainable use of anaesthetic gases. But it's much broader than that. And it was launched officially to the nation in March 2023. And there are segments of work, so about 50 actions in total, that are being released in sort of packages, if you like, to health boards within Scotland in order to really implement that green theatre programme. And it's a recognition of how much impact theatres in secondary care settings have on carbon utilisation and energy utilisation. And the aim is not only to be, and it's that whole thing of core benefits of improving both the patient and staff experience, as well as having that really good impact on our environment. So it's examined a whole range of things such as pharmaceuticals, anaesthetic gases, systems. So again, it's looking at where are gases lost within the system, where are the high carbon and energy intensive processes within theatre, looking at the use of equipment, for example, plastics, as well as the practice. And I've just given one example. So, if you Google this, you can find all of this. And there's like little, basically almost like little project packages. And one of the aims, for example, within National Green Theatres is to change the expectation to use perioperative paracetamol from IV to oral. And that's been something that's been quite successful. I think assisted, may I add, by the reduction in availability of IV paracetamol, which has been quite fortuitous, but it has helped kind of nudge that change from IV to oral paracetamol. So it just gives you an illustration of the fact that green theatres is far broader than just looking at the use of gases. And this is something that every health board in Scotland is tackling and looking at. And it's led by the Centre for Sustainable Delivery, which badges a lot of the pathways which are looking at value-based health and care and realistic medicine. Thought this is a really useful list. This was from the CMO report, which I shared just a couple of slides ago. And it's really highlighting that we can act individually by making wise choices. And I mean, I came into this post and realised, I mean, I've always been interested in respiratory medicine. And it's that, that slow realisation of the impact of inhaler use, for example, and actually better respiratory care that can have a much better impact on people and climate change. That's really, I suppose, stimulated my interest in medicines and climate change and pharmacy and climate change. So it's really sort of thinking, what gets you interested? What's hooked you into making a difference? And I thought this was quite an interesting sort of list for somebody who's perhaps not as hooked in yet, but actually, as a clinician, as a healthcare professional within pharmacy, there are lots of things that we can do to reduce our impact on the environment. So, for example, good preventative medicine. And for me, that means, and I'll talk about this a bit later, but whenever I'm, for myself, I like to keep active, I like to keep fit and healthy. By doing exercise, I realise I'm doing quite a sedentary job a lot of times, so I make that effort for myself, and I try and encourage that with my patients. I've recently started a walking group weekly for my respiratory patients in one of the GP practices that I look after. I do a clinic there once a week, so just half an hour before the clinic start my clinic, I do a little walking group. It's just slowly taking off. It's like anything; it takes a while to gain momentum. But it's that practicing good preventative medicine and really sort of not going for pharmaceuticals as the first option if we can avoid it. Deprescribing unnecessary medications, so considering what you do prescribe. And interestingly, locally, I was talking to our care of the elderly consultant, and she's very keen on deprescribing and or reviewing prescriptions and reviewing what her elderly population are getting prescribed for that safety element. And it was a couple of weeks ago we were talking, and she said it was a real light bulb moment when she realised that actually what she was doing was not only benefiting her patients, but actually having a really positive impact on the climate change agenda. And she hadn't really thought about what she was doing in terms of reviewing medication being an environmentally friendly action. So again, it's just that those little light bulb moments that I think are really useful to kind of filter through to our colleagues who are maybe not so engaged and bought into the sustainability agenda. So again, realistic medicine really focuses on reducing the number of investigations that you request. If you're not going to actually act on a result, why do you need it? So reducing the volume of blood tests that are unnecessary. For example, using telephone consultations and low carbon meetings where possible. So I'm sure you're aware of the work that was, again, originated in NHS Highland, and we use something called NHS Near Me, which are those remote consultations. So it's using a package, a video consultation package, and that's really expanded in Scotland. We've got a lot of remote rural areas, so that's why it really started in NHS Highland. But for example, Dumfries and Galloway is a really there's aspects and areas of Dumfries and Galloway that are very remote and rural. It takes about 3 hours to travel from one end of the area to the other, and it's been really, really beneficial. I do mindfulness. I teach mindfulness for pain, and I've done that through NHS Near Me. So again, I can save all these people travelling to a room, where often they've got physical disabilities that make it difficult. So actually, having those remote facilities has been really, really beneficial. And the rest of the list, I think, is fairly self-explanatory. Reducing our use of PPE. Interestingly, one of my medical colleagues has been doing a little project on when people use gloves in a hospital setting, and she found that people were using gloves because they were there on the wall, and people kind of thought there was an expectation to use them, but they didn't actually know why they were using them, and they were using them for simple examinations when there wasn't any requirement or necessity for the gloves. And so they did simple sort of nudge theory and basically removed gloves from the rooms and just put them in areas where a sort of central area by the nursing station, and had posters to encourage people to think about why they were using gloves. And the other kind of aspect to that was that they realised that when people were using gloves, hand hygiene wasn't as good. So actually, when people weren't using gloves, their hand hygiene was better. So lots of really interesting work around that PPE and disposable gloves, etc. in secondary care settings in particular, but in all settings, I think we could extend that to. And then simple things that I'm sure we all use in our day-to-day lives, switching things off, reducing our energy use, thinking about active transport, particularly for getting to and from work, having more plant-based food in our diet, and using reusable containers. Our hospital canteen and across the region, in fact, has now introduced a charge for using disposable containers to encourage people to use their reusable cups and pottery plates, etc. And there's quite a lot about auditing and sort of encouraging QI practice, which I'll come on to later. So there's some really good examples there about how we as individuals can really think about our professional impact, but also think about encouraging those around us to also have an impact on the environment in our day-to-day professional life. So if we think about specifically the work of the Effective Prescribing and Therapeutics Division in the Scottish Government, we have been doing a lot of work over the years, led by my boss, Alton the Mayor, who has been looking at really encouraging that person-centred medicines review. I haven't shown, and I perhaps should have, but I'm sure everyone's aware of that pie chart, which has the divides up the impact of various actions in the NHS and the impact of that on the environment. And medicines is by far the greatest proportion of that pie chart. And that does include sort of the manufacture, the distribution and prescribing of medicines. So it's all of those aspects. So and I know that there is a lot of focus, for example, on what we do with medicines down upstream, but thinking about the sort of downstream use of medicines, when we actually prescribe a medicine, when we dispense and issue a medicine, is it appropriate? Is it doing what we want it to do? Are our patients getting the outcomes that we require or that we're setting out to? Have we had a shared decision? Focus on what we're expecting from that medication for that person. And it's recognising that within polypharmacy, we've got multiple medicines that can be beneficial, but there can also be potential harms, and having that benefit versus risk discussion and really encouraging person-centred medicine reviews for those with polypharmacy, which of course is just more than one medicine. And also recognising that individuals' needs can change over time, so it's important to regularly review the medicines. And there are some tools available. Again, I've got links to these later. So the Managed Medicines app, which also includes a link to some patient-reported outcome measures. So basically, that's a little question. It sounds very fancy, but basically it's a questionnaire that patients can look at to think about what they want to get out of a medicines review, and also they can reflect on whether they've achieved that afterwards. And a lot of the research around shared decision making and effective medication reviews shows that if people are prepared and have an understanding of what they want to achieve, then they get far more benefit from that. And again, kind of just reflecting on why all of this is really important. Again, beyond the harm to the individual person from medicines or adverse reactions from medicines, thinking about the fact that 1 in 6 unplanned hospital admissions are due to harm from medicines. So that's based on sort of the most recent report by Purna Mohammed. Half of these are actually avoidable if we do regular medicines reviews. So if you think about that, now this is from a Scottish perspective, that amounts to about 46,000 admissions a year that could be avoided. This is from unplanned hospital admissions, so acute admissions due to medicines harm. So thinking just purely about the carbon footprint of those hospital stays, usually using an average of about 7.7 days of a hospital stay from an unplanned admission, if we manage to address that, that would save about 44,000 tonnes of carbon dioxide. And that's about 1.5% of our total carbon footprint in NHS Scotland. So it's not insignificant. And you could, again, we've used different ways of illustrating that, either from, from the number of plane journeys from Paris to New York, or journeys around a small petrol car, or we could cover Murrayfield rugby ground 100 times with trees, and that would produce or save the equivalent amount of carbon. So quite, not only are we thinking about the impact on the person, but thinking about the impact on the environment from potential from medicine harms. So the iSympathy project is one of the sort of flagship projects that has been developed to really understand how or understand the benefits of medicines review to patients and the individual, and thinking about the impact on the environment as well. And it was a co-funded project between Scotland, Northern Ireland and Ireland. It was an EU-funded project, and it's used a multidisciplinary clinical approach to medicines review, really ensuring that patients have been integral in that sort of shared decision making about what they want to achieve from their medicines, and utilised and developed and shared some really great tools, which I'll share with you. There's some links there to some more information, but I'll give you a bit of a summary of what we've found. So at the end of this sort of 3-year project, sort of if we think about both the environmental and personal impact of those medicines reviews, the appropriateness of medicines was improved in 92% of reviews. There was an average reduction of 1 medicine, so from 12 to 11 medicines per person. Patients had a better understanding of their medicines, and there was improved adherence and less harm reported. And they gained an average of 7.4 quality adjusted life years per 100 patients. There's some good quote there from one of the patients from Ireland about the fact that after his medication review, he was able to walk for 30 minutes every morning without getting those heavy legs and wheezing. So really good personal impact there as well. A reduced potential for clinically significant adverse drug reactions, and 4% of those would have potentially resulted in major organ failure or were of similar clinical importance. So, really having a good impact on reducing the harms from medicine. And the bit that all of our finance directors sit up and listen to, the direct medicines cost savings were averaged out at £131 per review. But also there's that sort of ripple effect of the total of 1,688 savings from avoiding healthcare resource usage. And the impact on healthcare professionals. So one of the consultants in Scotland that was involved had made a comment that they had really started to make significant changes to medicines as a result of those medicines reviews. And the medication review is all centred around what matters to the person. It's that 7-step process. And if you're interested in knowing more about that 7-step review process, we have got training available. So the training is available to anyone who's involved in prescribing medicines, and it goes through this person-centred medicines review 7-step process. So there is a TURAS login. You can access the training free, and you just have to follow the login instructions on the website under the resources if you're out with Scotland. But it does work for everybody. It's free training, and you can see if you've got any medical colleagues, they can get 3 points of external CPD if they complete it. So it's training that we're happy to promote and share. So I think these slides are perhaps going to be shared anyway, and you can either jot that down or look at that later. So just as, again, sort of more impact of trying to reduce that medicines waste by conducting reviews. I think we've all kind of seen these pictures of the big bin bags that are carried and returned to community pharmacies when somebody has a bit of a clear out of their cupboard, or unfortunately when someone dies. And during COVID, we were able to actually measure how much waste was being returned to community pharmacies and get a real idea of the amount of pharmaceutical waste. So bearing in mind this is just purely waste that was returned to community pharmacies, we in Scotland gathered 365 tonnes each year, and that was sent off for incineration. So about a ton a day, basically. And that disposal alone costs us £250,000 in Scotland. But and again, just the disposal of that alone has a CO2 equivalence of 700,000 miles, which is 28 car journeys around the world. So we know that that's only the returns to pharmacies, and we know that that's only really a small proportion of all of our medicines waste. We have a really good network or really good links now with Scottish Water, and that's through the One Health partnership that Sharon Flake is really active in, and has really worked well with Scottish Water and SEPA, which is the Scottish Environment Protection Agency. So as a result of that, Scottish Water have got this poster that they've updated. They've been having a big push on trying to discourage people from disposing wipes and nappies, etc., down the toilet. So they've actually added medicines to the poster. So it's been great to have that shared collaboration and recognising that we want to save or safely dispose of medicines, and flushing them down the loo is not the way to do it. We know that ends up with residues of pharmaceuticals accumulating in waterways and having the impact on plant life and the ecotoxicity that can then result in. So it's trying to encourage the disposing of waste safely, and that includes inhalers. And again, on the right, this is available from the Greener Practice Toolkit. Again, I'm sure you're all aware of the Greener Practice website, but this poster was actually developed in Greater Glasgow. And we've got some really great little practices that are early adopters of our sort of respiratory environmental work, and they developed this poster to encourage people to return their inhalers with all their other medicines to the pharmacies for safer disposal, recognising that there's still residual propellant gas in inhalers even when they're empty. So that's been quite successful. At the moment, we are not we've not got any recycling schemes at the moment, but I think that's because we are waiting to sort of seek a learning from pilot studies that are going on in recycling from both Wales and England. So it'd be interesting to see how that goes on. And then I wanted to talk to you briefly about the quality prescribing guides. So this is kind of one of our main flagships, really, from the Effective Prescribing and Therapeutics Division. It's a whole suite of quality prescribing guide. The one that most people are aware of is the Polypharmacy guidance. And again, surprise, surprise, that arose from NHS Highland. We've got a very active bunch up in NHS Highland who are great at sharing and collaborating all their and sharing all their good work with the rest of Scotland and internationally as well. So the Polypharmacy guidance, we've also got the quality prescribing for respiratory guidance, which is going to be published next week. We've just published our quality prescribing for diabetes earlier this year, and we are updating our quality prescribing for chronic pain. There's also quality prescribing guidance for antidepressants and benzodiazepines due out as well. And each of these guides now includes information on environmentally sustainable options. And that sustainability is embedded in that 7 steps review process, which I talked about earlier. So it's recognising that sustainability is talking about climate as well as cost. And all of these guides have been developed with stakeholders as well as people with lived experience. And they're really looking at putting practical guidance in to clinicians, to people who are prescribers, to patients, in order to really adopt the sort of national guidance. And the aim of all of these prescribing guides is to reduce potential harms from the inappropriate use of medicines and to reduce the generation of any medicines waste, but also address really what specifically matters to the individual. The Polypharmacy guidance I mentioned briefly. I'm sure a lot of you will have used the Polypharmacy guidance. Again, it sort of it talks about that realistic prescribing, which is our common vocabulary in Scotland. Polypharmacy just reflecting that we use that could mean many medicines or more than one medicine, but that there can be appropriate polypharmacy. But it's really, again, just targeting those areas of high risk, so those high risk combinations. It's looking at promoting the prevention of ill health, considering those non-pharmacological approaches. And again, it's got all those 7 steps medication review processes with worked case studies. So with we've got the revision of that is currently underway. We've got lots of new hot topics and lots of additional case studies. So that will be going out for consultation in the summer. And so you'll get a look at that in the summer. And as I say, there is international interest in the Polypharmacy guidance. It's used all over the world, which is great. We've got the quality prescribing guidance for diabetes. And again, that really focuses on using prevention and lifestyle as the first line, and then thinks about using other appropriate therapies and when they should be used. So the lifestyle is and diet and activity is really pushed, and that's the middle of this is showing that the members of our team practice what we preach, and we really try and do a bit of that diet and activity. So that's one of my colleagues, Fiona, who does a bit of running. That middle picture is me doing some wild swimming in a beautiful loch local to me, and the other picture is one of our clinical lead GP doing some kayaking. So just to show that we do practice what we preach in a beautiful area, a beautiful scenery of Scotland. And then the sort of quality prescribing for guidance for diabetes really focuses on what therapies should be used, but also recognising that even when we're using medicines appropriately, we can still end up with them finding their way into waterways. So really highlighting the benefits of if we can prevent the development of type 2 diabetes mellitus, and that can be, that would be the ideal, but we know that's always not possible. But we also accept that actually once you have got a type 2 diabetes mellitus that needs treatment, managing this well with appropriate medication prevents that sort of development later on to things like CKD and the need for dialysis. And if you look at the impact of dialysis, then that's hugely impactful on carbon dioxide emissions compared to the use of metformin and sitagliptin, for example. And simple changes such as using reusable pens instead of the disposable pens, and thinking about sensible, appropriate blood glucose monitoring, and ensuring that we're not overdoing tests that aren't going to be necessary, is really, again, part of that environmental impact of diabetes. Don't want to say too much about our respiratory guide, because obviously Ravijot did a great presentation last time to the network around respiratory, but just to say that the main thrust of our respiratory guide, which will be out next week, is really, again, that person-centered medication review, optimizing disease control, because we know that better respiratory care is greener care, and really focusing on things like reducing over-reliance on the short-acting reliever inhalers, ensuring that inhalers are used appropriately, so that we're teaching inhaler technique and checking that, and supporting the use of our low global warming potential inhalers, as well as the safe disposal. And again, we really like the greener practice resources, and we've really adopted this 4Ds, the sort of right diagnosis, the right drug, right device, and right disposal, as a kind of framework for our recommendations within the quality prescribing guide. Mention the antidepressant and benzodiazepine guides. Again, wanted to highlight these because there's a big push on that non-pharmaceutical approach, and the term blue-green prescribing, which Jules up in Highland has been doing some research on, doing his PhD research, supervised by Sharon Flager. So again, it's that recognition of the value of the using blue spaces, using water, using green spaces to really get out and improve our well-being. We have our sort of NHS website. It's called NHS Inform, in NHS Scotland, and that's where patients go and get all their sort of assured advice, and that often signposts to many non-pharmaceutical links. So we've got something called Silver Cloud, which is an app or a website based facility to really help CBT for sort of anxiety and low-level mild depression, and it's often a really good first referral point, really, for patients who have access to internet. And again, promoting things like use of CBT practitioners, yoga, mindfulness is all something that we really advocate within our antidepressant and benzodiazepine guide, as well as highlighting the impact of certain antidepressants on waterways, and sort of really recognising the impact of some of these pharmaceuticals on the waterways. Wanted also just to touch on antimicrobial resistance, because again, this is coming under our realistic medicine agenda and value-based health and care. Really trying to promote that antimicrobial stewardship to tackle, the health emergency that is antimicrobial resistance. We're working with our key stakeholders. So SAPG is a Scottish antimicrobial prescribing group. It's led by a consultant microbiologist and has really good multidisciplinary representation. And they are really trying to promote that sort of appropriate use of antibiotics, reducing the length of duration of treatment, so 5-day treatments in the majority of cases where appropriate, but also, thinking about the choice, is an antibiotic necessary, and if it is necessary, ensuring that people do actually take the full course of treatment, and promoting sort of IV to oral or oral solid dosage forms rather than liquids, etc. And it is, it's really startling when you realise that, 2022, nearly a third of our population received at least one course of antibiotics. So it's quite alarming, but something that I think is not just unique to Scotland. I mentioned our tools. We've got the Right Decision Service, which is an app and also based on a website, as hosted on the website as well. So we've got all of our guidance is translated into the app and on the website. We also have toolkits within those. So there's the Polypharmacy, Respiratory, diabetes, and antidepressants, I think, is on there as well, or medicines of dependency. But all of our guidance will be on that Right Decision Service platform, and is available for patients and for clinicians. We also have some various ways of monitoring. It's probably worth mentioning at this point that Scotland doesn't have QOF. So within primary care, we don't have the quality and outcomes framework. So a lot of our work that we do with practices in general practice and primary care is based around clusters, which are small groups of GPs and GP practices. There is generally multidisciplinary involvement, so with our nurse colleagues, pharmacists, physios, etc. But we have cluster quality leads, and they basically focus on areas of quality that they want to work on within their cluster. So we try and provide a lot of tools and monitoring to assist in that through things like the National Therapeutics Indicators, which gives them the data from national prescribing to enable them to have a look at whether what they're doing is having an impact. So that gives you, that's open access, a bit like your open access prescribing information in England. And that gives you one example, for example, of one of the NTIs around diabetes, which is a number of sulfonylureas prescribed to those aged over 75. So we've got a whole suite of those national therapeutic indicators linked to all the prescribing guidance. And then within general practice, we've got a facility called the Scottish Therapeutic Utility, which can suck out data from the GP practice system, which we use Vision or EMIS, and that basically searches for patients under all of those indicators and enables practices to target and prioritise those patients for review. So, for example, if you wanted to look at everyone who's ordering over 12 salbutamols a year, that's due search would identify those patients in your practice. It would exclude those with COPD, and you could start to review those as a priority. I mentioned about the sort of quality improvement brief for our clusters. Within the Right Decision Service apps, we have quality improvement toolkits to assist our practitioners. They've also been sent big packages of information, big sort of we try and do this quarterly. They've had a package of information on diabetes. They've had a package of information on respiratory. We've got a package of information that I think has just gone out on polypharmacy. We've got support with all of those within the app, guiding practices or practitioners, whoever's wanting to do some work in the practice on in a QI format. So that's available for anyone to look at. It's not just available in Scotland. And just to give you an example of one of the projects, this is we have a system called ScotGem. So this is a Scottish graduate entry medicine. So it's recognising that in certain rural and remote areas, so for example, Dumfries and Galloway, Highland, we need to really attract GPs, and so we have that graduate entry medicine, and they have placements in remote and rural areas. So they do a 5-year medicine degree, but it's really a lot of placements in areas that we want them to end up working in. And throughout their 5 years, they do projects every year with a climate emergency focus. So they start off with an audit in the first year, and second year onwards, it's a QI project of increasing length. So this is work I've just done with some second year ScotGem students locally, and they basically did a really good little poster, put it on Facebook, etc. Just really encourage patients to actually return their inhalers to pharmacies and GP practices when they're empty, because I know that one of the issues with the recycling pilots have been that they've not actually had people returning their inhalers. So I kind of think if we can get that habit into people now of encouraging them to return inhalers, then that might be very useful. That's just a little local example. Last but one, I think this is, so CivTech is something, again, it's a Scottish government project looking to the future. We're really looking to see if we can get some technology-assisted solutions. So we put tenders out for projects to anyone in Scotland or beyond who wants to sort of look at those proposals. It's meant to be a really fast turnaround, really to try and think outside the box about technology-driven solutions, as I say. And so a lot of our proposals that we're putting out recently have been around climate change and emergency, and we're really we're looking to see if we can get some ideas around polypharmacy and medicines waste to really try and think about, upstream and downstream use of medicines. So that's just sort of, there's nothing, no results on that yet, but just to sort of show that we are trying to work with partners in industry and in research to really look at lots of solutions to help use medicines better. So lastly, I want to just kind of think about, I've given you loads of examples of work that's going on in Scotland, and a lot of it is about trying to use medicines more appropriately. Really think about treating preventative medicine, treating patients holistically, putting the person at the centre of medicines reviews, and thinking about that whole medicines journey. And it can be quite overwhelming. I know that I can feel quite overwhelmed when thinking, oh gosh, there's so much to do. What do we tackle first? So something that locally we've been using quite a lot is to try and really think of our sphere of influence. So this is the circles of influence you may well have come across before. It's in Stephen Covey's book, which is very popular amongst leaders, and it's the 7 Habits of Highly Effective People. But if you think about really focusing on that smaller circle initially, that's where our circle of control is. That's what we can directly control or impact. And then as we nurture that will grow. It really helps our well-being because we know that we're having an impact. We know we're having an effect. And then we are aware of our circle of influence, so the concerns we can do something about. We don't have control over the outcome, but we can influence it with what we are able to control. So with these wider networks, such as the Pharmacy Sustainability Network. And there is that wider sort of circle of concern, which we may be concerned about, but which we can have no control over the outcome. So it's really kind of trying to think about all that's happening and think about what we can do, what can we inspire and change within our circle of control. So I just wanted to kind of leave you with that to sort of see if that can inspire or motivate you to do something within that circle of control in your own area. And lastly, we know that sort of better care is better for the person and for the environment. And there's my email if anyone has got any queries. So I'll call it a day